ahead and get started. Hello, everyone, and welcome to this month's Community Conversations webinar. Today, we are discussing how the Oregon Office of Rural Health supports critical access hospitals and rural health clinics in Oregon. I'm Sarah Anderson, and I'm the Director of Field Services at the Oregon Office of Rural Health. And I'm joined today for today's discussion by Stacy Rothwell, who's a program manager for critical access hospital quality improvement with our office, and Rhonda Younghurst, who is our rural health clinic program manager. We also have a special guest with us today, Elisa Sokolsky, from the Oregon Echo Network, and she is going to briefly discuss upcoming programming that they have around substance use disorders. Our community, excuse me. Having trouble advancing the slides. There we go. Our Community Conversations webinar series is a bi-monthly offering where the Oregon Office of Rural Health presents its program offerings to support rural health in Oregon and also cover hot topics. You can also find more information about these webinars on the ORH website, and I'll add a link in the chat towards the end of the webinar. I can't do so right now because I'm in presenter mode. But our next Community Conversations webinar, we're going to cover population health efforts at critical access hospitals, rural health clinics, and community-based organizations through programming that our office offers. And that community conversation will be on September 28th at noon. And then on November 16th, we are celebrating National Rural Health Day for our November community conversations. And we hope that you'll join us for that celebration at noon on November 16th. Again, I'll put this link in the chat later. And also, just to let you all know, we will be posting these slides on our website and we'll email them to everyone who registered today. And the links will be live within those two places as well. So for today's agenda, we are going to do an overview of our field services team that supports critical access hospitals, rural health clinics, and EMS agencies in rural Oregon with finance, operations, population health efforts. Stacy Rothwell is going to talk in more depth about our quality improvement activities for critical access hospitals. Rhonda Younghurst is going to talk about our programming related to rural health clinics. And Stacy and I will discuss the work that we do with critical access hospitals within financial and operational improvements. And then I'll discuss data and analysis that we have available for rural Oregon and our EMS programming as well. And then Elisa will discuss Project Echo SUD programming for us. Okay, so first I'd like to orient you to the Oregon Office of Rural Health Field Services team, and I'll discuss our objectives and our goals quickly, and then we'll move into our overall programming. So our field services team is made up of 5 team members who support critical access hospitals, rural health clinics, and rural EMS agencies with technical assistance, educational programming, grant offerings, and data and analysis, as well as population health. As a team, our primary objective is to assist rural Oregon communities to pilot, develop, and improve evidence-based healthcare delivery systems. And the team also works to increase the voice of rural health in our state. Our goals are to provide current data and funding to support rural health facilities, provide data and analysis to support policy making, grant applications, and strategy for rural Oregon health facilities. We also engage in rural and frontier listening tours to hear from rural constituents about their needs and suggestions for improving healthcare for rural Oregonians. We administer grants to support rural health facilities' efforts to manage rural health clinics, support population health, and improve quality operations and training in rural EMS agencies. We also provide technical assistance for rural healthcare facilities and communities. Specific to RHCs, we offer technical assistance related to certification or recertification, compliance, operations, billing and coding, and emergency preparedness, among many other topics. And for critical access hospitals, we focus on quality improvement, finance and operations, population health program, and we also administer the Small Hospital Improvement Program, or SHIP, which is available to rural hospitals with 49 beds or less. For rural EMS agencies, we focus on quality improvement and finances and operations by providing educational programming and supporting attendance at conferences. Okay, so first I'm going to orient you to the funding that supports the work that we do. And so our work is mostly supported by federal grants, the state of Oregon, and Oregon Health and Science University, where we're housed. But we're going to focus on two specific grants that support the work that we do with critical access hospitals, rural health clinics, and EMS today. And those are the FLEX or Medicare Rural Hospital Flexibility Program and the SHIP program, which is the Small Hospital Improvement Program. The FLEX program offers us approximately $700,000 a year, and it is a 5-year cycle, which we're actually ending in 2024, and we'll have a new competitive award cycle in 2025. This work supports specifically quality improvement, which is required for us to address. And again, Stacy's going to talk about those efforts in just a bit. Financial and operational improvements. This applies both to critical access hospitals and to rural health clinics. Population health and EMS integration with rural hospitals and critical access hospitals. Our SHIP grant works somewhat hand in hand with the FLEX grant. There are several of the same goals to support financial and operational improvements and quality improvements specifically. So this is a pass-through grant through HRSA. And as a state, we apply to HRSA on behalf of all Oregon rural hospitals, SHIP eligible hospitals each year. And generally, the award is around $375,000 per year for the state of Oregon, which breaks down into $11,000 per eligible hospital that's given through and passed through funds to small rural and critical access hospitals in Oregon. We just started a new 5-year cycle June 1st, and that goes through May 31st of 2028, and then we'll apply for another 5-year cycle. And the SHIP funds are generally used to support quality improvement and reporting activities. So think of trainings that hospitals may embark upon to support quality improvement, like root cause analysis or PDSA cycles, that sort of thing. ACO or shared savings programs. So this can support joining an ACO, for example, or purchasing a population health data management system or social determinants of health data collection system. And then prospective payment systems. So here there's training on ICD-11, et cetera. And I'll talk more about the SHIP program and how that operates towards the end of our webinar today. All right, so now I'm going to turn it over to Stacy Rothwell, who's going to go into more depth about the quality improvement programming that we offer. And I'd like to invite you all to, as we're going throughout this presentation, think about the questions that you have, and we'll do a Q&A session and discussion at the end. So I'll turn it over to you now, Stacy.
Okay, perfect. Thanks, Sarah. So yes, I am Stacy Rothwell. I am a program manager here at the Oregon Office of Rural Health, and I do work primarily with critical access hospitals across the state in the area of quality improvement and reporting. So we do have basically two focus areas that we focus on with the quality work that we provide here at our office. And the first focus area is to provide support and resources to critical access hospitals so that they can be successful in their reporting of the Medicare Beneficiary Quality Improvement Project, or MBQIP measures. These measures are a set of rural relevant quality measures that are aimed to improve the quality of care that patients receive specifically in a cost setting. The MBQIP measures also often tie to existing CMS reporting programs that our critical access hospitals are already reporting on. And this is aimed to lessen the burden of reporting for the hospitals. And it's also aimed to assist critical access hospitals as we move to the value-based payment methodology. The second focus is to provide support and resources to critical access hospitals so that they can be successful in just their overall quality improvement efforts. And we do this by encouraging facilities to evaluate the data that they already have to identify opportunities for improvement, and also we encourage QI efforts to improve the quality of care for patients as well as patient satisfaction. So next slide. And just a little bit more about the MBQIP program. So critical access hospitals are required to report on the MBQIP measures in order to participate in any of our flex funded activities that we offer through our office. So those don't just include the quality work that we do. The hospitals have to report on MBQIP measures if they want to participate in finance and operations activities, which includes our RHC work, our EMS work, or any of our population health work. And the MBQIP measures fall under 4 domains. They're listed here: patient safety and inpatient, patient engagement measures, which is our HCAHPS measures, care transitions, and outpatient. So all 4 of these domains are areas that we are required to provide programming and activities for our critical access hospitals under our FLEX grant. And there is a little asterisk here that I want to mention. The Federal Office of Rural Health Policy, they have adopted changes to the MBQIP program that are going to be rolled out over the next year. And so be on the lookout. We're putting together announcements and gathering all of the information so that we can inform our critical access hospitals of those changes over the next couple of months. Next slide. I wanted to share a little bit of an overview of the actual work that we do with critical access hospitals and how we support them. One of the areas is supporting the hospitals with our antimicrobial stewardship programs. What we do is we offer memberships to the Center for Stewardship in Medicine up at the University of Washington. This is an ECHO-based program that members are able to join their weekly ECHO sessions. They also have a portal that is just full of resources and toolkits and just a lot of great information for members to utilize. They also have access to their subject matter experts at the University of Washington to help with their ASP program. Also part of the CSIM work that we do is we offer participation in their intensive quality improvement cohorts. These are offered to a limited number of critical access hospitals that participate in CSIM. And what they are is they're advanced focus groups that focus on asymptomatic bacteria, urinary tract infections, and just overall appropriate antibiotic use and appropriate culturing and treatment criteria for those conditions. The work that we do with CSIM is a multi-state collaboration. So what that means is if your facility is participating with CSIM or participating in one of the ICLICs, they are also participating with critical access hospitals in the states of Arizona, Idaho, Montana, South Dakota, Utah, and Washington. We also offer an MBQIP and quality improvement webinar series each year. This past year, you can see these bullet points. These are the topics that we authored for our 4-part series that we completed this past spring. We'll probably be doing these webinar series in the winter or early spring this next year, and we'll have a new set of topics for the webinar series when we announce that. So be on the lookout later this fall or early winter for that series. We host an annual Quality and MBQuip conference each year. This past year, we hosted it in Seaside at their convention center in May. We will be hosting another one this next spring in the central area or Central Oregon area. So be on the lookout for save the date and additional information in regards to our next conference as well. Next slide. So just a continuation of some of the work that we do. Our patient and family engagement and care transitions virtual cohort. It's a 5-month cohort that focused this past year. It focused on breaking down the silos among our critical access hospitals and their rural health clinics throughout the care transition process. This was kind of a new one for us this year. We've offered the patient and family engagement cohort in the past, but this year we added the component of working directly with the rural health clinic staff as well. And it was a huge success. We got a lot of great feedback in regards to this, and it helped the clinics and the hospital work through some of the challenges that they encounter when they're moving that patient from the inpatient setting and getting them established in that outpatient setting. So we will definitely be continuing that again this next year. The turning data into improvement, we just wrapped that training up at the beginning of August. We held that this year up in Enterprise. This is an in-person training that teaches strategies on how hospitals can utilize quality data for improvement. And the critical access hospitals that participate, they walk away with a PDSA cycle that they take back and implement at their organizations. We also support professional development opportunities for our critical access hospital quality professionals by providing scholarships to get their CPHQ or their Certified Professional in Healthcare Quality certifications through the National Association of Healthcare Quality. This past year, we supported 13 quality professionals in getting their CPHQs. And then also we provide the MBQuip monthly newsletter and announcements. This is published by the Rural Quality Improvement Technical Assistance Team, or RQITA, but it also includes updates on quality and MBQuip related, the landscape and activities. And we also provide information specific to Oregon as far as activities and offerings that we're doing from our office. Next slide. So the Oregon CAH Quality Network, this has been a really successful thing that we've done in our office. We're going on, we just had our 2nd year anniversary of the Quality Network. The purpose of it is to bring critical access hospital quality professionals together to share and learn among their peers. And folks are really taking advantage of this Quality Network, and it's a big success. We host monthly Quality Network sessions via WebEx, and it allows an opportunity for quality teams to jump on a session. They have their cameras on so that they can see each other, and they can bring questions if they're experiencing a challenge at their facility in regards to quality or quality reporting, or even site visits. They're able to bring those to their peers and learn and gather information from each other. So really a positive thing that's going in a great direction. And we had the opportunity this last summer to implement site visits to peer facilities. So far this summer, we had a site visit in Bandon at Southern Coos Hospital, and up in Enterprise at Wallowa Memorial. In September, we have another site visit at Tillamook. And what this does, it allows a CAH quality team to travel to another facility and do a tour and learn about how the quality programs are ran at another facility. And there's usually a training or learning component that the hosting facility provides They share information on a successful quality improvement project that they've done. And it just provides a lot of time for networking and bringing people together with their peers. And then the Oregon Rural Quality Excellence Award. This is a new program for the Oregon Office of Rural Health. If you are on any of our mailing lists, you've probably received communications more recently about getting your nominations in by the end of this month. They're due on August 31st. The purpose of the program is to honor the commitment to healthcare quality in our rural communities. It's open to all rural hospitals, including critical access hospitals and rural facilities, rural health clinics, and rural community-based organizations. They're all invited to apply. And we're looking for folks that demonstrate exceptional dedication to quality improvement as well as successful implementation of performance improvement strategies that help improve the safety of their patients. So if you are doing any type of work at your facilities around patient safety, we want you to brag about yourself and submit a nomination. So this particular one is hyperlinked, so you can visit our website and look at the criteria and also reach out to me if you have any questions at all. So we will be awarding 3 awardees at our Oregon Rural Health Conference in October. We'll provide an award to 1 hospital, 1 rural health clinic, and 1 community-based organization. So hopefully we'll see some additional applications come in after today's webinar. And then last, I have on here that we conduct an MBQIP and quality needs assessment periodically. Generally, we do this when we're writing our Flex grant each year. And by gathering information on this assessment from critical access hospitals, it helps our office learn about the challenges and successes that the critical access hospitals are having in Oregon so that we can better align the activities that we write into that grant to make sure that they fit the needs of our facilities here in the state. So with that, I think that sums up most of the quality work that we do here in Oregon. And I'm going to go ahead and hand it off to Rhonda Ann.
Hi, thanks, Stacy. Hello and welcome, everyone. It's good to see such a great turnout at the Community Conversations. I'm Rhonda Ann Gerst, one of the program managers here at the office. The RHC program began in 1977. Orchid Health, McKenzie River Clinic in Blue River, was the first RHC in Oregon. Today, there are 112 RHCs in the state. 61 are provider-based rural health clinics and 51 are independent. Through the Flex Grant Program, the Office of Rural Health supports critical access hospital-owned rural health clinics with a focus on financial and operational improvement. The State Office of Rural Health Grant Program supports independent RHCs. I have listed some of the activities completed this year and the activities the Office of Rural Health will offer in the coming year to support rural health clinics. Okay, let's see. Practice Innovation Project Grant. The Practice Innovation Project Grant supports innovative ways to improve operation, increase revenue, and improve workflows in RHCs. The Office of Rural Health has offered this grant to RHCs for the past 4 years. Past projects include a community health worker-led smoking cessation support education group for patients, staff, and community members, a 6 pillars of lifestyle medicine, educating patients on lifestyle and behavioral changes to improve one's health. New in 2024, this grant program is rolling into the Rural Population Health Incubator Program. Details on this program will be available in 2024. Next, the Professional Development Scholarships for RHC leaders. Throughout the year, the Office of Rural Health announces the opportunity for various professional development scholarships. Some of the scholarships offered are the Oregon Medical Group Management Association membership, including the Pacific Northwest Medical Management Conference. This scholarship is a 1-year membership to the OMGMA and attendance to the 2023 Pacific Northwest Conference. The Office of Rural Health awarded 4 scholarships in 2023. We will follow the same activity plan in 2024, so look for the scholarship in December. Certified Rural Health Clinic Professional Course Scholarship. This course is designed to teach leaders the RHC basics. It covers operations, the value of the RHC program, and best practices. This year, the office awarded 25 scholarships. We will offer the scholarship award again next year in 2024. And finally, the Spring and Fall National Association of Rural Health Clinics 2023 Institute Scholarships. This is the only conference dedicated to the RHC program. A total of 12 RHC leaders received the Office of Rural Health Scholarship. 6 attended the 2023 NARC Spring Institute in Texas, and 6 leaders will attend the 2023 NARC Fall Institute in Florida. Staff training on improving patient experience scores. The RHC Patient Experience, the Value of the Survey, is a short video series clinics can use to educate and train their staff on the Patient Experience Survey. I have included the link if you would like to share the video with staff. Okay, RHC Compliance Cohort. This is an 8-month compliance program which brings together Oregon RHC leaders preparing their clinics for recertification and working to maintain ongoing compliance. Each year, approximately 6 to 8 RHC participants gather in a small cohort. We bring subject matter experts to present on policies, procedures, the biennial program evaluation, emergency preparedness, and more. Each participant is asked to complete 2 clinic compliance improvement projects, along with receiving tools and resources they can use and take back and use in their clinics. The RHC mock surveys. The state recertifies RHCs approximately every 7 years. The Office of Rural Health provides free in-person mock surveys to help prepare clinics for the unannounced state survey inspection. The RHC schedules the mock survey a couple months in advance, generally lasting 2 to 4 hours. During the mock survey, the findings are reviewed and the clinic receives a report within a couple weeks. If you would like to conduct your own inspection, I have included a link to the Office of Rural Health RHC pre-inspection practice tool. I generally complete probably 10 to 12 mock surveys a year. Please reach out if your clinic has an interest in a mock survey. The annual RHC workshop. The Office of Rural Health invites subject matter experts nationwide to present on RHC legislative updates, compliance, coding, billing, and more. The workshop is held every year before the annual Oregon Rural Health Conference. This year, we're trying something new. The RHC workshop will be a track within the conference. This year, the conference will be held October 11th through the 13th in Sun River, and I have included a link to the agenda and registration. Okay, RHC webinars. The Office of Rural Health hosts RHC webinars throughout the year focused on coding, billing, emergency preparedness, and cost reporting. Look for those webinars in 2024. RHC networking calls. Patty Harper is the subject matter expert and moderator on these calls. The group discussion allows clinic leaders to network with colleagues from around the state on RHC topics. We discuss current events, challenges, and more. I have included the link to register. The next RHC networking call is December 5th. Bi-weekly RHC newsletter. This newsletter covers the latest RHC news, Oregon-specific updates, resources, webinars, and funding opportunities available. It is emailed every other Tuesday. Please click the link to sign up for the newsletter if you are interested. And finally, technical assistance. I provide TA by phone or email daily on a variety of questions. For example, where do you file the CMS 29 form? Coding and billing questions, regulation questions, or steps to become an RHC. If I receive a question I'm unsure of, I will refer the person on to an RHC consultant. I use an RHC distribution list to keep in touch with the RHC leaders and clinics around the state. And if you would like to be included on the list, please email me and I will be happy to add you to the RHC distribution list. These are only some of the RHC activities the Office of Rural Health offers RHCs. If you would like more information on the RHC program, any of the above opportunities or technical assistance, please reach out. I have provided my email and phone number on the slides, and thank you very much.
Thanks so much, Rondi Ann. So we're going to go into now some other financial and operational improvement activities that we do as part of our Flex grant, specific to critical access hospitals. I'll let Stacy take the first bullet and then I'll cover the rest.
So we do offer scholarships, various number depending on our budget each year, to the National Rural Health Association's Rural Hospital Certification Program. This is a partnership between the NRHA and the Center for Rural Health Leadership. And originally, this program started out by offering the certification program to CEOs, CNOs, and CFOs, and they have expanded over the years with this last year, a pretty big expansion. So not only do they offer the certifications to the CEOs, CNOs, and CFOs, they've also expanded it to chief medical officers, HR, human resources, and board of trustees, as well as a rural health nurse certification program. So this past year, we supported 7 executives to go through the certification program. Since the beginning of the program, there have been over 20 executives in the state of Oregon that have participated. Not all necessarily awarded through scholarships through our office, but just in general, we do have quite a good following for that program, and folks are taking advantage of it. So that's what I have for that.
Thank you, Stacy. And then the other activities that we offer or monitor, I should say, in some cases, related to financial and operational improvement. One is that we do statewide operational and financial needs assessments, which is a required part of our Flex grant. And we monitor this information through the Flex monitoring team's Compass tool. The data lags a little bit, but we're regularly looking at those data points to assure the financial and operational health of our rural health, or our rural hospitals, rather. We also monitor financial and service line data and dashboards through the Compass tool. We do a quarterly review of all critical access hospital financial and operational data, including a comparison of whether they're on cost-based reimbursement or APMs, just to monitor the landscape of how finance and operations are going in rural hospitals across the state. Additionally, this year in 2023, we launched a webinar series, which includes, we have a couple left, 2 left, 10 webinars focused on finance and operational improvement. And so topics have covered growing a swing bed program, tips to manage the revenue cycle, and those sorts of things. There's a link on this slide for those webinars where you can sign up for the last 2 that we have. And then also the recordings and slides are available on that website as well. And we're planning to offer an additional 5 webinars in 2024. We also provide technical assistance regarding critical access hospital finance and operations on an ad hoc basis. So feel free to reach out to me at any time, and you'll see my email address on the very last slide for questions around CAW finance and operations. Stacy can also be helpful in that area, and we often work together in addressing those types of questions. I'm going to really briefly cover our population health work, and the reason that I am covering it briefly is because our next community conversations will describe our population health work in much more depth. Again, that community conversations is on September 28th at noon. And Stacy put a link in the chat at the beginning of the webinar where you can find more information out about that. But you know, kind of within the realm of population health, we do the Forum on Aging, the Forum on Population Health and Equity in rural Oregon. This will be the first year that we're doing this particular forum, which grew out of the Forum on Aging in rural Oregon, which we've been hosting for the past 7 years. Aging will have a track within the Population Health and Equity Forum. But we wanted to expand it out, recognizing all of the good population health efforts that are going on in rural areas in our state. This forum will be virtual in 2024, then we'll be in person in 2025, and we'll swap back and forth for those forums. We also offer population health grants. We just awarded this last round about 3 weeks ago. And we prioritize our population health grants based on our areas of unmet healthcare needs report, which really kind of shows the availability and accessibility of healthcare within rural areas of our state. And so we prioritize giving grants to the areas that score low on in that report, but we also provide those grants to other organizations who aren't necessarily the lowest scoring folks. We are awarding up to 4 $10,000 grants per year. And as Rhonda Ann mentioned, we're rolling the Rural Health Clinic Innovation Grant into this project as well. And in addition to providing grants, we're going to be offering technical assistance, identifying resources to help these population health efforts sustain going forward. So please be on the lookout for more information about that. We hosted a 6-part population health webinar series this past year. The link is on the slide for you to go and listen to the recordings. We covered topics such as collecting social needs data, working with and paying for community health workers, etc. So I encourage you to take a look at the recordings that we put together of those webinars on our website. We also are in the midst of a 2-year project to train community health workers in rural Oregon. It's a pilot program where our office was awarded grant funds by the Oregon Health Authority to pay for training of community health workers. And then those students are either current incumbent workers at the facility or new hires, and they're placed at critical access hospitals, rural health clinics, and/or public health departments. And this works in conjunction with our HRSA Rural Public Health Workforce Network grant, which is also training community health workers in different regions than we're focused on with the ORH program, and also is developing a community paramedic program out in Malheur County. Lastly, under our population health bucket, we focus on telehealth support and also broadband technical assistance. Stefa Dragoon, who's our population health program manager, is also on the broadband advisory committee for Oregon, and she'll talk more about that work and all of our population health work on September 28th. I'm going to also cover our the data and analysis that we provide. And this list here is not necessarily all-encompassing, but gives you a flavor of the data and reports that we have available at our office, most of which is led by our data and GIS analyst, Emerson Ong. So the first piece that I want to highlight is our areas of unmet healthcare need in Oregon, in rural Oregon report. And it ranks all 130 primary care service areas across the state according to 9 variables that measure access to primary care, dental care, and mental health care. We publish this roughly every August, and within the next few weeks, we'll have our 2023 report available. The 2022 report is linked on this slide, and encourage you to take a look at it. It's really helpful in understanding access and accessibility of healthcare across rural areas and the health of the communities within them as well. We also offer service area profiles, and I put a link in here for an example of one. And these provide demographic information of your service area or any service area you're interested in taking a look at. Excuse me, as well as a socioeconomic profile of the area and the area's vital statistics. And they also offer insights into the number of providers in the area, supply and demand for primary care in the area, and more. So these are really useful in understanding primary care service areas, and also useful if you're writing a grant, for example, and need some statistics about the population and healthcare environment in a specific community. We also offer customized data analysis, presentations, and mapping, and ad hoc reports. All of these are on an ad hoc basis, and we're happy to provide data that we have access to, and also happy to engage in writing reports that support rural healthcare in Oregon. We also do a community benefit report where we take a look at all of the critical access hospitals in the state and where their community benefits are being directed toward. And we've also done listening tours, as I mentioned at the beginning of the webinar. Those that we have published currently focus on EMS, as well as critical access hospitals. We were going to do one for rural health clinics in 2020, but that was waylaid by the pandemic. And we hope to get our listening tours up and going again in the future. Finally, we have, it's a little bit older and due for an update, but we have an Aging in Rural and Frontier Oregon report as well that we published several years ago, and it pairs very nicely with our former Forum on Aging in Rural Oregon. I'm going to turn now to EMS integration, our EMS programming under the FLEX program, as well as our Helping EMS in Rural Oregon program, which is partially FLEX funded, but not completely FLEX funded. So through our FLEX program, we offer assistance with operational and quality improvement in various ways. For example, we offer 2 EMS and critical access hospital simulation events each year. This year, for example, we were just down in Bandon at Southern Coos Hospital a couple of weeks ago and did a simulation, which involved the EMS agency, the hospital, 911, Life Flight, etc., responding to a scenario where a child was rolled over by a log. And it was a really excellent event to identify where improvements could be made, how comfortable and confident people feel in their skills to respond to those sorts of rarer emergencies, etc. And tomorrow, as a matter of fact, we're having another one at Samaritan Lebanon Community Hospital. We offer these simulations to hospitals that have not engaged in one over the past 5 years. We also offer scholarships to state and national EMS conferences. In particular, one that we focus on is the National Rural EMS and Care Conference, which is hosted by the National Organization of State Offices of Rural Health, and that's held each April. And that's a full scholarship for EMS personnel to attend. And then lastly, we support under our Flex program an innovation grant to improve the alignment and standardization of pre-hospital and hospital emergency care among critical access hospitals and the EMS agencies that transport to them. This grant is $5,000 per year, and it's offered in the winter. So please be on the lookout for more information about that opportunity coming up in the next few months. Our HERO program, as I mentioned, is partially supported by our Flex funding and partially supported through donations that we receive from outside organizations. And HERO stands for Helping EMS in Rural Oregon. And it was started as the Apple a Day program. And the reason for that is because so many of our EMS personnel are volunteers who have to take time off of work to go to a training, or maybe they had to pay for their training initially and have to pay for additional training to keep their EMS certifications up to par. And so we offer $2,500 scholarships to roughly about 5 to 10 EMS agencies per year to support their training needs, because we know that that's so critical, especially when it comes to EMS reliant on volunteers in rural Oregon. Over the past, I guess we're at 13 years, we provided 250 individuals with awards, and 50 agencies were represented by the awards that we made. All right, and then the final piece that I want to talk about that our field services team provides support to critical access hospitals for is our small hospital improvement program. So as I mentioned earlier, this is a pass-through grant that the Office of Rural Health applies for on behalf of all 31 SHIP-eligible hospitals in the state. And this is an annual award, which is roughly around $11,000 per hospital annually. It's my understanding that this program started at the federal level to support hospitals in implementing ICD-10, and it's expanded quite a bit since then. So now the funding supports equipment and/or training for value-based investment activities, accountable care organizations, and shared savings activities, and payment bundling or prospective payment system investments. For this year, which just started on June 1st, each hospital will receive $11,045 to apply to one or more of the categories that are listed in the bullet above. And last year, we started a pooled option where we're working with a company called Wintergreen, as well as the University of Washington Center for Stewardship in Medicine that Stacy talked about a little bit earlier, to offer a pooled program. And what that means is that we're contracting with those entities and paying them directly, and then those companies provide the training and programming that is eligible for SHIP. And then they report for the hospitals after those trainings and programmings have been completed. And this really reduces the administrative burden on the hospitals of going through the contracting process and the reporting process. With Wintergreen, some of the menu options that hospitals are selecting from include critical access hospital financial and operational assessment, swing bed maximization or growth, emergency department operations assessment, patient safety trainings, and provider-based practice, financial and operational assessments. And there are a few others that we offer through that as well. So really excited about the opportunity to provide those pooled options to provide really high quality programming with less administrative burden for the hospitals as well. And so now, as I mentioned, we'll take questions at the end of the presentation, and I encourage you to put them in the chat as we go along. But I'm going to turn it over to Elisa, who is with the Oregon ECHO Network, to talk about their substance use disorder programming coming up here that's really relevant to rural health clinics, hospitals, and community-based organizations.
Thank you so much, Sarah. So my name is Elisa Sokolsky. I'm an internist, psychiatrist, and addiction medicine specialist at OHSU, and I spend part of my time working with the Oregon ECHO Network addiction medicine programs. Today, I'll provide an introduction to the programs and several other services that are available to providers in Oregon. Oh, next slide. So today, as I said, I'll talk about ECHO. I also want to let everyone know about some telehealth options for buprenorphine prescribing and the OHSU Addiction Medicine Consult line. So what is ECHO and how is this different than telemedicine? So ECHOs are typically run as weekly seminars that take place over a set period of time, usually 10 to 16 weeks, where an expert hub team of providers come together. And typically for our programs, this is a medical provider, a pharmacist, social worker, peer support specialist, and we have learners at sites throughout the state of Oregon. We come together to discuss cases and go through didactic sessions. And the idea is that the ECHO participants will then go back out into their communities, into their clinics to spread that knowledge. So rather than a one-on-one traditional telemedicine experience, the goal here is to train community sites, train learners throughout the state, and then they become experts in those areas of knowledge. Next slide. And we follow the principle of all teach, all learn. Every time I have participated in one of these ECHOs or worked as more of a facilitator, I always learn something from the cases and the discussions. The idea is that participants learn from the faculty, participants learn from each other, and the interdisciplinary faculty learn from the participants. So we're discussing complex cases and we're all learning together. Next slide. So why do addiction medicine ECHOs exist? The medical education system traditionally has not equipped providers to treat substance use disorders. Only recently are we really seeing this being integrated into medical school education. In addition, caring for populations with substance use disorder, while under-equipped, leads to provider distress and worse outcomes. We're seeing parallel epidemics in Oregon. There's so many difficult situations that are coming up, especially with the rise of fentanyl use throughout the country and rising overdose deaths. These can also help with skill building, practice support, and facilitating team-based care. In addition, there is a very high need in Oregon in particular for substance use disorder treatment. There's a very nice gap analysis that was done by the public health school at PSU and OHSU that shows that compared to the national average, every county in Oregon has a higher risk of hospitalization for alcohol or drug use. So we have a very, very high unmet need. And in addition, over half of substance use disorder service providers in Oregon lack the capacity to meet the demand for treatment services. So what are the benefits of participating? So ECHOs provide no-cost CME. There's absolutely no cost to participating. They also meet the new DEA training requirement. So everyone who goes to renew a DEA license or apply for their first DEA license will have to attest that they've received 8 hours of substance use disorder education. And if that wasn't provided as part of medical school training, everyone's going to have to get that training somewhere. So these programs will meet that requirement. It also provides professional development, creates community. Everyone is there working through these difficult situations together. Increased patient satisfaction. One of the great things about these echoes is the ability to bring cases and discuss them in real time and be able to bring those recommendations back to your patients. And that also improves quality of care. And for participants who complete several of our echoes, there's the option to get an addiction medicine certificate. And we have a lot of programs. We've really expanded since we started in 2017. We run programs in the fall, winter, and spring, and our fall programs are currently open for enrollment. Most of them are kicking off next month. Just to highlight a few, and I'll talk about a couple of them in more detail, but this fall we have substance use disorder and ambulatory care. We have one specific for providers working in hospital care, one for jail settings. We have a new one that we started last year that focuses on substance use disorder in adolescents. And in addition to that, for people who have taken echoes before and are looking to continue to build that community, we do have a special program that runs throughout the year called Curbsides and Conversations. That's a once-a-month meeting where people can bring cases for discussion. Next slide. So just to touch on a couple of our programs that are kicking off soon, the Substance Use Disorder and Hospital Care ECHO. Next slide. So this is led by a multidisciplinary faculty panel that leads a discussion of participant cases. So people who are enrolled in the ECHO will present a case and we'll discuss together. There's 2 hospital addiction medicine providers. I'll actually be the lead facilitator for this ECHO for the next 3 sessions. A behavioral health social worker, a peer support specialist, a nurse manager, and a hospital pharmacist. And this is the topics that we cover. So half the session is typically case discussion, and then there's a 30-minute didactic. So we'll cover things like buprenorphine in hospital care, methadone in hospital care, harm reduction, how to have difficult conversations, peer perspectives, and then medications for alcohol and methamphetamine use, trauma-informed care, managing acute pain in patients with opioid use disorder, and then bigger systems questions like around community treatment and organizational level change. In addition to that, for providers that work in outpatient settings, we have a kind of a sister program, the Substance Use Disorder and Ambulatory Care ECHO, that's led by an addiction medicine physician, a psychiatrist, a behavioral health specialist, and a peer support specialist. And they also cover a number of topics, including the neurobiology of substance use disorders, buprenorphine basics, PTSD screening, addressing trauma in primary care, tobacco use disorder, alcohol use disorder, methamphetamine, benzodiazepine, and marijuana use. So it's a really robust list of topics. I've taken this ECHO as a participant and had a really great experience. And then just to highlight one more, this is a program that kicks off actually in the winter, the Chronic Pain and Opioids ECHO, that's led by an addiction medicine provider and primary care provider, a pain specialist, a pain psychologist, physical therapist, and a peer support specialist as well. And it's a little bit of a longer ECHO. They cover a lot of topics. I won't read through each one of those, but just a few that I want to highlight. Opioid failure, what to do if someone is on opioids and it's not adequately treating their pain. Movement and pacing for chronic pain, so really focusing on the physical therapy aspect, trauma, tapering, and basic nutrition. It's a really robust ECHO. And this is one I've also taken as a participant a few years ago and had a great experience with. So where to learn more? There's a QR code that will take you directly to our website, but the website's on the top of this slide as well, and I'd be happy to put it in the chat. If you go to Addiction Medicine, there's the opportunity to register for our fall programs, which are all open for enrollment. And then if you see a program later on, like in the winter or spring, there's the option to pre-register, and then they'll send you an email when it's available. And even though my job is primarily working with the addiction medicine ECHOs, there are many other wonderful ECHOs that are provided by the Oregon ECHO Network, including programs on behavioral health, psychiatry for primary care providers, including a program for children, child psychiatry. I know that's a very popular one. I'm not sure what time of year that one runs, but if you want to check out the other programs, they're on the website as well. A couple other things I want to highlight just in terms of other resources that are out there. There are telemedicine buprenorphine resources. So if you're working in an area where you don't have access to be able to prescribe buprenorphine, there's the OHSU Harm Reduction and Bridges to Care Clinic that provides telemedicine low barrier buprenorphine. They take patients regardless of whether they have insurance. They take all comers. If you have someone that needs to get on buprenorphine, doesn't have access, they can see anyone in the state of Oregon through telehealth. There's also Boulder Care, which can see patients in both Oregon and Washington. There's some information as well, and patients can self-refer to either of these services. So if you're seeing a patient in the emergency room, in the hospital, in the clinic, and for whatever reason they need access to care, these are resources that are available. The last thing, or actually second to last thing, is the OHSU Addiction Medicine Consult line. So I'm actually staffed this line about 25% of the time. If you call the OHSU Consult line operator, Monday and Friday between 8 to 5, you can ask to speak with an addiction medicine provider. So if you're working in really any setting, hospital, clinic, emergency room, and you run into a problem where you need real-time advice from an addiction medicine specialist, as long as it's Monday through Friday between 8 and 5, give us a call. Usually we get back to people pretty quickly. I'm often returning calls right away unless I'm actively meeting with a patient, and then it might be a little bit of a delay. But this is a service that we provide. And I realize I didn't put a slide about this, but just one last thing to let you know about. If you're going to the Oregon Rural Health Conference in October, on Wednesday, October 11th, I'll be teaching one of the pre-conferences on buprenorphine. We're doing a buprenorphine training from 8 to 12. You can register when you go to register for the conference. And that will also it's a 4-hour training, and that will meet half of that DEA requirement for 8 hours of training. So if you're interested, you need to meet that requirement, you want to learn more about buprenorphine, come join me. Thank you.
Thank you so much, Elisa. And I'll put the link for the Oregon Rural Health Conference in the chat here in just a moment. But you have the option to select whether you want to attend that training that Elisa just mentioned on the registration form for the conference as well. And with that, we are going to go ahead and enter our Q&A portion of the session. So I'm going to stop sharing here. And so I can see the chat, and would really love it if folks could put their questions in the chat, and we will go ahead and answer those questions as we go along. Now I need to find the chat. I'm so sorry. Let's see. I lost that screen. There we go. Oh, thank you, Stacy. Put the link for the conference in the chat for me as well. All right, looking through, I'm not seeing any questions now. And as we wait for questions to come through here, I just really want to thank Stacy and Rondianne and Elisa for all of the great information that they shared here today. I hope everyone finds it useful. And if you aren't thinking of a question right now that you want to ask, I know that we are all happy to answer questions via email, via phone. You will have the information to reach out to us when we send out the slides a little bit later between tomorrow and Monday as well. All right. Still not seeing any questions. So we really do hope to hear from everybody as you move along in your work and you need support. We're here to help you. Really appreciate you all being here today, and we hope to see you again in September for our next community conversations. Thanks so much.